Hello and welcome. Today we'll be talking to you about very briefly what are the 6, 7 steps for systematic review and meta-analysis. It's just an extra step in this regard, maybe an extra half step. My name is Dr. Rahul Kashyap. I'm a physician scientist and researcher, and then I teach and mentor um, the clinical research along with Dr. Professor Nawaz Zararshad through GRRSP. So these are the 7 steps, and then I'll go one by one on those steps. Step number one is your idea selection, which many of the GRSP scholars have already gone through. My comment on this particular step is that you have to be very, very careful what idea you're picking up. Of course, if you're spending a lot of time doing the systematic review, you want to pick and choose the idea from the field you are in or you aspire to be in. That's the first and foremost point. Second idea is you should have enough studies in that particular research question you are asking, idea you are asking is the litmus test is you should have minimum 3 studies which has the data you are looking for, which are the same clinical question, same exposure, same outcome, same tools they have used it, and you have the data around it as well. You can quickly look up and saying, can I find 3 clinical trials, systematic review, meta-analysis, cross-sectional studies, case control studies, and cohort studies. Of course, you cannot use previous review or systematic review in your systematic review, but it gives you an idea that if somebody has done already, they might have already found some studies as well. So looking into those things is going to be very, very important. The exposure and outcome is going to be very key. Like idea is exposure, what your clinical question is, and in that question what you are answering it. Let's say if I give an example of smoking and lung cancer, that means smoking is your exposure. So each study should have enough people with smoking and a comparison group. That's where you generate odds ratios, and then you do the pooled odd ratios in your systematic meta-analysis. So you have to have numbers of patients who were in that group and how many got exposed, and outcome wise how many got lung cancer. That applies to any new medication, new treatment, the cardiac failure, any scabbage and STEMI and all those things. Whatever your favorite field is, looking at the similar exposure and the numbers around it and outcome and numbers around it, you have to have those raw numbers in the original studies, and then you are good for your idea selection as well. There are other ideas where you don't have direct outcomes, things like that. They're just looking for observational or just one group. There's no comparison group. You can still do systematic review and meta-analysis on those as well, where you just write down the prevalence and 94% confidence interval, or sometimes you are doing the tools like, let's say, a AI tool and things like that, where you have sensitivity, specificity, negative, positive, predictive values, and things like that, where your exposure, your odds ratios, and those do not apply as well. Always pick up a topic where not too many systematic reviews are done already. Otherwise, what's the point of doing it? You may not have enough novel studies left to include into your systematic review. Or sometime you look into that, if even though their systematic reviews are done or meta-analysis are done, but they're not in recent past. If you have 3, 4, 5 years a delay that they have done last one in the past, that doesn't mean that nobody else is working on it. You can check those things in Cochrane or Prospero, and then get a glance at if somebody has registered anything as well, and that will be a good idea as well. So you can check out these things before you finalize your idea and selection. And at this stage, many of you, those are listening today, have gone through this idea already. Now, then you move into second stage. Once you have done that, your goal is idea is for search criteria. This is a very crucial stage. You are setting up search criteria for the studies to be included in your systematic review meta-analysis. Our first and foremost advice is create your search criteria for PubMed first. That's a little bit more complicated. In that, you can set a rule of 3, and I'll go into that part of it. In addition, if you can pick one more search database, which could be Scopus, Web of Science, or Cochrane, if you're doing meta-analysis and things like that, that'll be a good idea too. Sometimes we agree just to do one database, which is a PubMed one, will be okay as well. People have used a Google Scholar and other things as well, but my recommendation to stay in 2 or 3, no more, no less than 2, no more than 3, and then after that, there's a lot of repetitions happen. Is if you're looking into nursing literature and things as well, then you have to include SynHealth database, which is very pertinent to nursing literature. Otherwise, PubMed and Scopus, PubMed and a Web of Science, PubMed and Cochrane should be a good one for you as well. The rule of 3. When you develop your search criteria, goal is that you want to have your disease entity. Let's say if I'm doing sepsis and I'm comparing crystalloid versus colloid. So you want to use sepsis and all possible synonym of sepsis. They're going to be in or function, sepsis or severe sepsis or septic shock or inflammation or SIRS or whatever is your synonym of that particular disease. You should be able to use all of them. Then in AND function, if I'm looking for colloid, then I'd say colloid and heterostarch and albumin, all in OR functions. If these are things I'm looking for, or crystalloid, or this, because those are my exposure group I'm looking for. And then you're looking for mortality, then look for mortality or death or hospital discharge status or 30 days discharge or 60 days discharge. So that way, your rule of three is that you should have your outcome listed somewhere in the search criteria. You should have your exposure listed somewhere in search criteria and your disease entity. And after that, you can develop multiple filters and things like that. Using OR and AND function in PubMed is intuitive. It's complicated to start with, but it's super easy once you do maybe one or two searches by yourself. It doesn't take, if you take 45 minutes to 1 hour of spend on PubMed search function, especially advanced search function, it will come to you automatically. In this time, you are doing a rough yielding. When you develop your search, it gives you a number of articles. You can adjust them for last 10 years, last 5 years, only the clinical trial and things like that, or anything which doesn't have a full articles, you can exclude them at this point. And then just look at any 3 sets of 10 to see if you're getting 30 to 40% yield. Like every 10 articles, when you're reading their title and abstract and say, you know what, yes, this article I want to include into my systematic review, that's your 1 out of 10. If you find 3 or 4 like that every 10, and maybe I suggest you to do any random 10 sets of 10, 3 sets of 10 in your yield, then that means your search is pretty okay. You can lock that search in, and then you can move into just develop the similar search on Scopus or Web of Science, and then just do it once, and then you are done with your search criteria establishment. I would usually do 2 or 3 iteration and then presented this work, and then their mentors can suggest you that, this is a pretty good search idea. They go through the search one by one and look at it. If you have missed anything or something you're doing it which is causing you to get too many results or too few results, it's very important to have one of your colleagues or one of your mentors look at that stage as you go through. When it comes for after you've done this, you have done all research, you have number of articles, then you come back to the screening step number 3, which is your screening phase 1. You took all these articles either just from PubMed or PubMed and Scopus and put them into a tool called Ryan or Covidence. There are multiple other tools. We recommend you to use Ryan tool. It should be free. There is no conflict of interest for GRSP on that. Use Ryan. We have used both of them in the past. Ryan is a little bit more advanced and intuitive. And then your goal is to set your inclusion exclusion criteria. And this all you can write down into your proposal or already think ahead as based on what other people have done for similar studies. Read their method section. That's where the more knowledge come from. Your goal is to set inclusion exclusion criteria. You want to set that I want to include studies which are XYZ. Mostly you already excluded studies which are retrospective or prospective cohort studies, case control studies, clinical trials, randomized clinical trial, and things like that. You exclude previous systematic review, you exclude previous meta-analysis, you exclude previous review articles, you exclude book chapters, case reports, and things like that. There's no 100% rule there that you are excluding case reports. If your topic is advanced enough or rare enough, sometimes you will be able to write down a case series based on the case report they're publishing if you're looking at a rare disease. So that depends on based on what questions you're asking. But 90% of the time, if you're doing a systematic review or meta-analysis, you are only including original studies, case control, cohort, clinical trials. Those 3 will fall into that categories to part of it. 2, you set your inclusion criteria. If the articles are not in English, they're going to be excluded. If articles doesn't have a full text, you can exclude it. I would recommend you not to exclude articles which are not full text at this stage, because when you go into screening number 2, and if you don't have it, then you should always reach out to your mentors. If you are part of GRSP to GRSP group, sometimes we have access to those articles which you may not have it through our university accounts. So I would not exclude those articles at this stage, because you can always get them later on. And then if you don't get it at later on stage, then you can exclude them. And if the articles are in not English, we talked about it. So that's where you do your own review of 5, 10, 15, 20s, set your inclusion exclusion criteria, go to Ryan, upload everything, and put down your inclusion exclusion criteria at that stage. My recommendation is read the abstract and title only, which is very quick, and then you can make a decision. I'm going to include it or not. And if you can't make a decision, you need to go to full text. You can read the full text as well and then make a decision. This screening is your sensitive screening. You are trying to include as many articles you think will qualify for your study. So in case you're not sure, for now you can include it because you can always exclude them later on in your screening phase too. So you are not trying to miss anything at this stage. How you do it? Selecting a team. So you can select the team members you're working on. If you're part of GRSP group, we highly recommend you to pick up team members within the same group. Sometimes you're going to include people from your own medical school or residency programs in other places as well. Work with the people you trust who can finish the work on task. That's who can finish the task on time. My recommendation is at least have 4 people, including yourself. That means you can divide the work in half. If you have 300 articles, divide 75 each, because each article has to be reviewed by minimum 2 people. So if you do 75, person number 2 will do the same 75. Person number 3, person number, if you are 300 articles, person one number will be do 150 articles. Team member number 2 will do the same 150 articles. Team number 3 and 4 members, they will do the remaining 150 blinded to each other. So dividing them 25% among each other, or sorry, it should be 50% each other. Otherwise, if you divide 25%, then there's no review around it. So if our 300 articles, divide 150 each for each one of them. So each article is reviewed by 2 people. In the first blinded review, you are setting the article saying, will you include it? Yes. Will you exclude it? No. And if you are not sure, then you put them into maybe category. What happens is that, you have said yes, the other person has said yes, we are good. You have said no, other person has said no, you're good, you don't have to worry about it. But if anybody has said mismatch, yes versus no, no versus yes, or somebody has said maybe, then you as a team leader is responsible going back and check your review and then see if you want to change your answer and then match with that person's answer. Or if that person is not, then you look into all these mismatches, set up time with the group people, and then ask them to do the consensus on those things as well. That's going to be very, very important. You want to have yes, no's. And if you can't still break the tie, and then there's something in maybe as well, then you reach out to mentors, and then they will be happily breaking the ties for you as well. We did talk about Ryan and Covenus, working with Ryan and all. This helps you develop your Prisma diagram where you have total number of articles from these 2 sources. We excluded because of XYZ reason, not in English, not full articles. Then we reviewed them and then we excluded further, and then number of articles remain in the end. That is a Prisma diagram comes in. We found a tool, this link, we can send it to you, where actually once you're done with the whole process, you can insert your numbers and it can generate a beautiful Prisma diagram for you, which you'll be using as a figure 1 for your main paper. Okay, we'll share this tool with you in the end. Now you've done your screen number 1. Now it's time to come for screening number 2. This screening, this is a specific screening. Now you only want to include the articles where you want to include them into finally. So you still stay on the Ryan. You have the number of articles. You read it 300 articles. You did the try breaking and everything else, and you're left with 60 articles, let's say, which everybody said, yes, we need to include them. You have already taken care of maybes and all no's and all. In this article stage, now you divide these articles once. You can go back to the same team members who have done it and ask them if they want to help further, because just doing the first screening doesn't earn you an authorship on a paper. They should help you with this part and also help you with the writing fee. So this is their opportunity now. Now you're left with 60 articles, and you can, as a team lead, you can take 20 of them by yourself or 30 of them by yourself, or 50. The more you take it, the likely it's going to end early. Otherwise, you try to divide them equally, then people might not be that enthusiastic. So I would pick up half of them by myself if I'm a team leader, and remaining you can divide equally in those them, and then tell them, please read the full article and give me which one you include in the end. This one you can do into Excel sheet. You can actually list all 60 of them in Excel sheet, give them the access to everybody on Google Sheet, and then ask them to say yes, no, final inclusion, yes, no, and who is reviewing it. You can have them do that part. So out of 60, you might kick out some articles because that the full text is not available, or it is not what you were thinking, or you try to reach out to in the end to your mentors to see if, at the end of 60 that you found 5 articles doesn't have the text, can you get us, and all those things. Same time when they're reading it, you can set your data extraction in the same Excel sheet and tell them, hey, you read it. If article meets the criteria, include them. And if you include them, collect these 15 data points, author name, which year. Main thing I'll talk about the data collection is the next phase is that what needs to be collected at the time, and set the time for 2 weeks. You should not take more than 2 weeks reviewing 15, 20 articles, because that's what the speed you want to set up. The full text reading is important at this stage. Without that, you will not know. And then as you're reading it, it's easier to actually do the data collection stage as well. It goes faster. My suggestion at this stage is, as you are setting up the screening number 2 for specific screening, the main lead of the project should at least already do 2 or 3 articles by herself or himself and set the rules and tones so that they can share those examples, and those examples are always at the top so then people know exactly how to collect the data. Because data collection could be messy. You only want the objective data in the columns, otherwise you have to do a lot of cleaning. So the better rules you set for people, the better they likely to collect the clean data for your projects. Then step number 5 is data collection. This step is something I was suggesting for doing in 2 weeks, that is combined with your specific screening, screen number 2 and data collection as well. Use Excel sheet. Goal is rule 1 row per study. Exception is if each study is using a different tool or some AI algorithm or something, and you are interested in that part, then you can create repetitive rows for that particular study. So then the same data is around it. Then you can use that particular tool from each study and write a subset analysis on that part of it. The first 10 columns are the key: your study ID, your author's name, exposure, total number of people in the exposure group, in the study group, how many of them, if they use total 500 people, 300 was in smoking group, and 800 was 500 is smoking and 300 not smoking group. You want to write down the raw number of the patients included in those databases. That's going to be the key, because with that, the pools, odds ratios, and other things will be calculated. Making sure that only the number column should only have numbers, no other words, not even per year or units and all. Put all these things into your title phases when you're saying it. Number of patients, 100. Hemoglobin milligram per deciliter on the title of the column, and then here you just should write 9.8 and something like that. Your numerical column should only have numerical value. Anything else which you have to put a comment section next to it, and people can write stories, they can write anything what they need to write it. To keep your numerical columns just for numerical values, and one column should have only one value. If you compel to write more than one value, create a new column. There is no cost for you to have multiple columns. It doesn't cost you to add extra column on Excel sheet. So don't be miser, don't be frugal about it. You can create 150 columns, who cares? The first 10 columns or 15 columns gonna be the one which should be utilized heavily for your data analysis. Rest will go into your systematic review tables. You can list them into your result section. Your outcomes, make sure that you're talking about mortality. It's a hospital mortality. If some paper is publishing 30 days mortality, create a column and write 30 days mortality, and then write down the number and percentages. If number is number, if you have a percentages, move them into a next column. Later on, you can actually calculate back the number out of it if you only have percentages given there. So we can go into that detail when we go to that part. You may wonder what columns we need to include. That comes from the literature. Read previous papers, see what columns they have listed, see what data they have collected. As far as you're including exposure and outcome variables and raw numbers around it, you are covered, but other variables might be pertinent there. Your clinical knowledge, talk to your mentors. Talk to your mentors once you look at the literature and created your own columns about that particular topic, because it's easier to work with that rather than working with a blank slide. Okay, we'll talk about it. We will bring a couple more experts in GRRSP to talk about specific data collection and analysis, but this is just an overview part of it. Data analysis, I'll not touch upon much, but this is systematic review. You're just using objective data. You're writing a table and that's it. Meta-analysis, you are doing this forest plots, meta regression and other things as well. That's why it's important to have those numerical values. Odds ratios, 95% confidence interval, sensitivity, specificity, just the prevalence and all those things will be included. And that is used by Raveman 5.0. It's a very easy tool. It used to be free. I know if it is free or not. You can insert your raw numbers. It will give you a beautiful forest plot based on what you're picking and choosing. This is so easy. We may go through this process, maybe 1 or 2 people in each batch. They are more advanced and they usually just test these things by themselves. And then they can teach other members in this regard as well. We will have extra session, and we are having extra session just on data analysis coming up, which is going to be in a separate course for anybody who's interested, as we start with one of our faculty member, Dr. Hans. Then last stage, of course, you can always use mentoring, and GRSP will help those who are part of it. Last stage is abstract and manuscript writing. Once you have your analysis done, you write a 300-word long abstract as your title, authors, background, method, result, and conclusion. No references in abstract. You submit your conference presentation. And as you're submitting it, you start working on a full-blown manuscript where actually you're going into detail and writing and putting figures and tables and prisma diagrams and everything else as well. And for GRSP scholars, that you will use the same presentation in your PowerPoint for 10 slides. You can include all these diagrams, and then you're expected to do that for your commencement and graduation speech in the end, a graduation presentation in the end, the day before you graduate. So these 7 points are something which is a very brief overview of what you'll be doing for next 4 to 5 months. Dr. Nawaz and myself will be happy to take questions, and then we are always there to answer it. Those who are watching on YouTube, please like and subscribe to our channel and let us know what you think about in the notes.